Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, March 4th, bringing you the update from Albany Med. All right, let's pop open the first graph. You can see currently in the capital region, there's 118 people in the hospitals with COVID. Fred, on Tuesday, we said we're watching the numbers. They're clearly coming down. Looks like for a couple days they'd plateaued, but the good news is they're coming down even a little bit more.
That's right, a further drop. And on our regional call this morning, again, we heard a drop. Our regional call is a little bit bigger than the capital region.
Right. Now, I misspoke on Tuesday. I think I said some number, what the high water mark was. I think I transposed some numbers. The high water mark was actually 553.
That's right.
So 553 to 118, which is great news.
It is.
Next graph, admissions and discharges. You can see that there. I think that speaks for itself. And then lastly, inside here at the medical center, the morning census, we currently open with 43 and 5 on ventilators.
That's right. And Dennis, 18 are non-infectious.
18.
And so that ratio stayed about the same, but obviously it's coming down with the total coming down.
Excellent. Now, Fred, one of the things that occurred today, which was pretty remarkable, is we went to the C4. They had their huddle this morning at 7 o'clock, which all the units do at 7 o'clock.
That's right.
Where they talk about metrics and they do a look back and a look forward.
Plan their day.
Plan their day. So today, turns out, is the 1-year anniversary, of the very first COVID patient coming to Albany Medical Center, and it went to C4.
That's right.
Which maybe not everybody knows. C4 is a unit that has a proud history here of treating infectious diseases. In fact, it goes back to the days of HIV/AIDS.
That's right. That's how it was established,
Right.
as that type of unit.
In fact, when Ebola was an issue for a while, that was the unit that would be designated to
That's
potentially
right.
treat Ebola patients.
Special expertise in dealing with infectious disease.
Incredible nursing staff. So they had a recognition of that today. Their nurse manager, Jen Miller, recognized the staff, and a couple of us were able to get up there, which was wonderful. I think we can see a picture here of a couple people who were there. Dr. Louis Philhauer was there as well. Just wanted to say it was really a very remarkable moment, and it was so proud to see how the staff kind of remembered the journey they've been on for the last year.
You know, Dennis, it's just really something. A year we've been dealing with this,
Yeah.
and this staff has been dealing with this
Yes.
disease for a year. Just a resilient group,
Yeah.
just having done a tremendous job.
You know, Fred, you once told the story about how when we were transferring the patients up from New York City,
Yes.
that you walked through the units and you walked through C4 and they were ready to go.
I still have those pictures on my phone.
Yes.
I took pictures of the staff. They were all standing there in their garb, waiting for those patients.
Special unit, special staff.
much
Thank
so.
you to them. Fred, on Tuesday we talked about visitation and whether or not there was going to be a change to the visitation rules. There's been a lot of, I think, very positive feedback from that, people talking about it on the radio. Let's review again what's happening.
So, Dennis, we've been working with other hospitals in the region because we want to try to do this as much in a coordinated fashion as possible. So on Monday, March 8th, we're going to open up some visitation here at the medical center.
Yes.
And St. Peter's Hospital down the street, Samaritan in Troy, and Ellis likewise are going to be opening up their visitation that same day. It's based on the rate of infection in the community dropping down to that 2% or below level. So visitation here at the medical center will be from 10 to 12 in the morning and from 6 to 8 in the evening. So it'll accommodate
Right.
the folks that are working and still want to come in and see their family members. We're going to screen people. Temperature screen them. We're going to require that they wear a surgical mask, which we
Right.
will provide, and we're going to go forward with this. Now, there are some exceptions, Dennis.
Yes.
You know, particularly vulnerable patients that might do worse if they were to get
Right.
COVID. You know, we may restrict some of that visitation.
Okay, so
But
there could be some areas where the visitation we have to wait
we have
until.
to we have to be careful
Okay.
because they're particularly vulnerable, and obviously birthing labor partners and parents of children, a little bit different, a little bit more liberal in terms of their visitation.
So to expand upon that, those areas you mentioned, women who need a birthing partner or parents of children, they would continue to be able to come in more than 4 hours a day.
Correct.
Okay, very good. There's been a lot of positive feedback on the two-hour pieces. I
Yes.
think that's a great adjustment.
You know, it helps. Families will be able to come in the morning when the physicians and other providers are around
Right.
and have face-to-face conversations. And then there's still that evening block for people who have to work.
Right. And so we're still under that 2% in the community.
We are.
Okay, great news. Fred, there was also an announcement made yesterday in the governor's press conference about the rules related to travel. Let me kind of state what the rule used to be, and then maybe you could describe how it will change going forward. If you were not one of the contiguous states around New York and you came into New York State, there was obviously a requirement to be tested for COVID upon entry into the state. And that was something that's been in place now for quite some time. We're now hearing that that rule will change based on your vaccination status.
That's right, Dennis. So what the governor announced yesterday was if you've had complete vaccination, so for 2-shot, you've had your 2nd shot, from 1 shot, you've had 1 shot, and you're 2 weeks out from your last shot, within a 90-day period after that, you don't have to quarantine, you don't have to be tested.
So that's fantastic. Some people are confused about the 90-day. They'll say, are you saying to me that I'm only protected for 90 days after the vaccine? And I think the answer is no, we're not saying that. We're saying right now we don't have experience beyond 90 days.
That's right, Dennis.
So we think over time that 90-day window might actually stretch out.
And there are recommendations from some of the infectious disease societies that get pushed out. So we'll likely see some changes in the not too distant future.
So this rule set about travel is in effect, and
So for our workforce, this goes into effect Monday.
that's fantastic. Fred, obviously we know from time to time there are particular days or weeks or months that are in recognition of certain populations, health-based populations. So there's 2 right now that we'd like to recognize. I'll do the first one. It's Colorectal Cancer Awareness Month. And, obviously we have incredible GI doctors here. We have incredible surgeons who operate on them. We have incredible oncologists. We have all sorts of specialists, physicians and nurses who care for this population. Incredible to recognize them. We're glad to do that.
Yes, absolutely. And the other group is nutrition. This is National Nutrition Month. And I'd capture that in 2 words: eat healthy.
Eat healthy, and it's incredibly important how nutrition plays in the recovery of patients in the hospital.
It really does. If you're malnourished, and I'm not talking about
Right.
people weighing 60 pounds,
Right.
You don't recover from illnesses, surgical procedures as promptly.
There's a whole science behind how many
Absolutely.
electrolytes you get, how many calories you get. So very good. Thank you to both of those groups. You mentioned on Tuesday, Fred, the importance of us refocusing our energies on length of stay for the reasons of quality of care, safety, being good stewards of the hospital, flow dynamics, so we can care for the whole population. Want to update us a little bit more?
Absolutely. So let's throw up the first slide. This is our total length of stay. It's a 7-day rolling average.
Yes.
And you can see it has climbed. So we're very focused on it. If we throw up the second slide, this breaks out the COVID portion. So the solid line is the non-COVID population length of stay. The dotted line is the total. So obviously the difference is the COVID patients. And remember, Dennis, COVID patients have a 11, 12, sometimes even much longer length of stay.
For sure.
So they skew that number. We're going to be talking about this a lot. I talked about it last night at the operating committee of the practice, this morning at the brief. We are going to refocus on this particular issue.
I mean, the one thing we know from certain is in the past, there were efforts to get that under control, and that happened. That was, everybody rowing the boat together, and we can do that again.
It's good care, Dennis.
It is good care, for sure. Fred, let's talk about an article. I know that from time to time you like to bring forward to us some articles that you're reading in some of the academic journals. And this one is important really because of some things that might be happening in New York State, and it's also a good public health message.
That's right, Dennis. So this is an article from the University of Michigan that's in the Journal of Adolescent Medicine. And what they did was they looked at lung symptoms in adolescents, teenagers who vape.
Right.
And particularly in those who vape cannabis or THC. And what they found is that the frequency of lung symptoms, cough, wheezing, asthmatic kind of reactions is twice as high in that population who
Yes.
vape with THC. So really not a good thing.
No.
There are potentially long-term consequences for teenagers who vape in general. There's a permanent lung injury syndrome
Right.
that we've seen now in a number of children across the country who vaped. Some of them getting so sick that they need lung transplants.
Right.
So I think it's something to think about. As you say, there's some conversation going on in the
Right.
state around legalizing marijuana. I think it's important for healthcare professionals to know that this is not a good thing for our youth.
And it's obviously, we have many people who watch these videos who have teenagers, and it's a good conversation starter, and perhaps we'll make that article available on our,
Yes, we
on
will.
our site. Last thing, today I think is the last day to vote for Best of the Capital Region.
That's right.
So I think there's two different categories we're in: Best Hospital and
best workforce.
Best frontline workers. Right,
Frontline
for
workers,
sure.
that's right.
Okay, wonderful. So if you haven't voted, we encourage you to do that because we think that in both categories, we think we certainly are the best because of you.
Absolutely.
Because of you. Very good.
Absolutely.
We will be back again on Tuesday. We'll be back again. So we'll see you then. We ask that you have a good weekend. We ask that you once again please take care of yourself, take care of each other, and we'll see you on Tuesday.